I actually wouldn't recommend for a national lockdown currently. I think we are in a position to control. We are in a third wave to start with, I admit that, but also the nation, I think we have lessons we learned from the second wave. So I know that if we can continue with focusing on hotspots to avoid the economic impact we had in the second wave on individuals. And I believe, and if we fast track the vaccinations also, it's helping. You remember in the last parliament, you had almost 30 or 40 MPs positive from COVID. It's not the same issue right now. Most people are okay because the whole parliament was vaccinated. So I believe the COVID vaccine does reduce serious morbidity. It doesn't reduce infection in general. And I strongly believe that as long as we continue with education and our localized control, we will succeed. Which won't be as bad as I hope as we faced. The vaccines, yes, there was initially when the vaccines came, there was very low uptake, and government could not take a decision of ordering vaccines which would expire. So that became a bit of a problem. A gap was there, but we have received a lot of vaccines now. And I last week inspected in Bulawayo UBH, there was a huge queue of both first and second. In Gucheni had a big queue. All the centers I went to, there were queues and queues of people. People have realized that it's important for them to actually get vaccinated. So it is happening now. It is happening now. My message to the ordinary Zimbabweans is the third wave is here. Protect yourselves, and we protect yourself as an individual. Even if you see a Zupco that is too full, don't get into it. Stay and wait for another one, because you can't afford to be in a room that is packed with people. Continue sanitizing, continue wearing your mask, and please, please, please go and queue for your vaccine. Yes, I agree with you. People also died. Some of them died due to hunger. Some patients on tuberculosis in the second wave did not get their medication because of the lockdown. And today we are talking, we are not sure where they are. So people will die from other things. They will die from diabetes because they could not go and get their medication. They will die from diabetes because they could not afford to pay for their medication. It won't only be people from COVID who die. It will be almost everybody. And even COVID wacho, if you are all not working, who can ambulance? So really, I personally believe that we should do exactly what the government has done. Phase it a bit and let's see where it's going. For now, I think let's continue. Allow the vendor to make money. That's how the vendor pays for school fees. That's how he pays for his rent. That's what he eats. So you're saying, it's better if your death certificate says died of hunger and not COVID. Death is death. No, there's not been a balance, because if you budget $20 to buy meal, and suddenly you find your child needs $10 to go to hospital, and you take that $10 to hospital, definitely something is just short of someone. And recently somebody called me yesterday. They are a small scale miner. They got injured in Nyati, and they were looking for a hospital to suture them. They went to 2-3 hospitals along that lane in Kai, wherever they went. They could not be sutured until they go to Bulawayo. That tells a story. Sutures are very cheap. Suture material is very cheap. That tells a story. A lot of people suffered. Cancer patients suffered. Diabetes patients suffered. They will suffer because those diseases are silent killers. They don't shout like COVID. No. You just hear people are dying, and that's exactly what happens. Part of government, what we should do, which brings me back to the alleged 5,000 pregnancies that happened, is because contraceptive could not reach people. To go to town, you had to pass through a roadblock where you must say, contraceptive. You could not get a permission for that. So what I would suggest is let's start now And I've been saying it. Use mobile clinics, especially in urban areas where we have a huge problem. Bulawayo and Harare, probably include Managwera, I'm not sure. Have mobile clinics that go from center, from Gomo to Kambuzuma in the morning. Offer basic things. Vanhu vaone maera vyavo, vanhu vaone ma-TB meds, their medication, vaone mishonga ye-BP, ye-sugar, and then settle down. We will deal with all these issues. It means even if I never buy you my vaccine, my vaccines out. The mobile clinic is a way to go during a crisis, so that you reduce movement because of seeking health care. Even contraceptives, people go to that car and get them. Look at us now, we're going to be, there's an epidemic of pregnancies in Zimbabwe, especially among the young girls. Leading cause of this
would it not be joint projects?
Is very simple.
Between Zimbabwe and China.
We have one, poverty. Because there's high unemployment rate. You find girls are easily wooed into relationships, sexual relationships, just to be able to get food. Then the second one, even to pay for university. Girls told us at one of the universities that we are paying our school fees through sex education. They told parliamentarians that. And then you have the legal framework. Our law says a girl who is under 18 is not having sex.
Not only that, it is also.
But we all know that girl, everybody, there are a lot of girls under the age of 18 who are having sex. And once we say they are not and they cannot access treatment, when she goes to an institution, which are Zingwa, and the nurse will have the right to Zinga, because otherwise the parents get sued.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.